Dr. Courtney Ariane Washington, and today is Valentine's Day. Happy Lover's Day to everyone out there. And in celebration of Lover's Day, we are going to talk about erectile dysfunction. It is very, very common, especially for those males over 40 years old. Let's get into the causes, let's get into the solutions, and let's talk about it. There are many different causes of erectile dysfunction. It can be psychological, like unmanaged depression or anxiety, or both. It can be physiological, which can be due to damage to the pelvic organs from cardiovascular disease, hypertension, diabetes, or it can be due to lifestyle, like cigarette smoking. Let's talk about how an erection happens. Whenever there's a sexual stimulus in the brain, it secretes neurotransmitters that stimulate the testes to produce more testosterone, and then that is a complex dance to the pelvic vasculature to increase blood flow into the penis to get an erection. Now, to maintain an erection, there has to be that influx of blood flow into the penis, and it decreases the blood flow out of the penis so you maintain that erection. So the first thing that is needed is healthy blood vessels in that organ. Whenever we think about cardiovascular disease or hypertension or diabetes, we think about the damage that it does to everything else, like the major organs like the heart, the brain, the kidneys. But what's happening in those organs also happen in the pelvic organs. So it's very, very important to prevent those disease processes from happening, especially if you have a family history or predisposition to that, because it happens everywhere. Another major important factor in erectile dysfunction or preventing that process is having enough of the enzyme called nitric oxide synthase. This enzyme is there to convert certain amino acids into free nitric oxide, which is a potent vasodilator that you can get that erection and maintain it. If there's not enough blood flow, then that whole process does not happen. The most common cause of erectile dysfunction was found in cigarette smokers. Cigarettes, they definitely damage your lungs, increase your cancer risk, but it also damages the vessels and it prevents that nitric oxide synthase from doing its thing so that you can do your thing. So that's the most common cause, and it's also preventable. It's stopping smoking. I'm not saying this quitting smoking is easy, but that could be the cause of erectile dysfunction. The next things that are most common in causing this problem are unmanaged hypertension, unmanaged diabetes, and low testosterone. So let's start with hypertension. Hypertension or elevated blood pressure can be due to having a family history of it, but if it's unmanaged and your blood pressure is super high everywhere else, then it's going to be hard to get that blood flow that you need into your penis so that you can get an erection. Definitely get your annual exams, see if you do have hypertension, and get it treated. The treatment of hypertension, some of the drugs can cause erectile dysfunction. The main culprit found in a recent study was shown that chlorthalidone had the highest incidence of erectile dysfunction. It's a potent diuretic. If you've been recently started on this medication, don't just stop it altogether because you don't want to get a stroke, right? Definitely see your physician. There are other medications that can be alternatives to chlorthalidone that don't have as much of an impact on erectile dysfunction. It was also found that medications like ACE inhibitors or ARBs, which are like lisinopril, losartan, and also calcium channel blockers like amlodipine had lower incidence of erectile dysfunction. And those medications are used primarily for hypertension as first-line agents. Surprisingly, a medication called doxazosin, which we don't really use primarily for blood pressure, it's a third tertiary medication, meaning like it's the third medication you can add on, improved sexual desire and erection. So that was very interesting. So definitely talk to your doctor about these medications and you notice that you have a new intimacy issue. Diabetes. Diabetes is very common, especially with these microwave diets and obesity. So if you don't know how you have diabetes and it goes unmanaged for a long time, it not only damages the vessels, but it can damage the nerves. And the nerves are very, very important for erections. So get screened for diabetes and manage it because you can prevent these problems. If you already have diabetes, being on certain medications and also increasing your physical fitness can help with erectile dysfunction and other problems of that sort. The last one that we'll talk about is depression, anxiety, and other mental health disorders. It's very important to talk about how you feel and in your mood. It's going to be hard for you to concentrate on the moment if you're depressed and you don't have the urge to do so. Whenever your neurochemicals in your brain are balanced, your brain is able to send signals to the important place to facilitate the other functions that come with getting an erection and maintaining an erection. So getting on the right medication to treat this and talking about it can have great positive impacts on your sexual health and function. It's important to get checked and see your doctors, guys. Lastly, I will say there are medications that can help with erectile dysfunction like Viagra and Cialis. These medications work by inhibiting the enzyme that breaks down your nitric acid vasodilator functions. They work very well. They also have side effects, but it's always also important to figure out what the cause of the issue is instead of just treating the symptoms, but they do work. Thanks for tuning in, and subscribe, like, share this video. Leave your comments below if you have any other questions on this topic or anything else health related. This is medical education, not medical advice. Thanks for tuning in. I'm Dr. Courtney Ariane Washington, and enjoy your Lover's Day.